over 16 million veterans in the United States.
First problem is positive.
This is pride and belief in a greater purpose than themselves. We all bear the burden of their sacrifice, and we share in this hard work to ensure no record is left behind. Justice for Vets is reshaping how the justice system identifies, assesses, and responds to veterans. We help connect justice professionals with the Department of Veterans Affairs to ensure veterans receive the benefits and healthcare they have earned. We inform, develop, and mobilize community partnerships to enhance delivery and support. We establish veterans treatment courts and provide conflict and code. Our experience and expertise extends beyond veterans. We help justice programs better address acquired brain injury, post-traumatic stress, isolation, trauma, and more. We impact every stage of the justice system, from initial contact with law enforcement to first appearance, from pre-trial and probation to responsive treatment coordination, and from program completion to long-term recovery management. We do this work for every person who is born to equal, and their community.
That's what we do in a nutshell, okay? If you notice when we do that presentation, I intentionally kind of bookended it with the cadence calling in the beginning, as well as cadence calling in the end. And the reason why I did that is not to lose sight, right? Not to lose sight that we are working with a specific population that has a military culture background and has those needs. So we want to be able to leverage that culture and that background. Okay, I'm back on track, I think, right? Almost.
You trying?
I'm trying.
A for effort.
I even have notes, huh? So, several years ago, SAMHSA, which is Substance Abuse Mental Health Services Administration, asked, hey, wait a minute. You all know who I am, right? You have my biography and that. My background's a lot clinical. I am a citizen soldier type of person. I actually spent 20 years in Rhode Island National Guard, which is the size of this county, by the way. And, and during that time, I was a clinician for about 25 years. I worked in the community behavioral health. I worked in the jail system, the prison system, the judiciary, and pretrial services as well. So that's kind of my background. So many years ago, SAMHSA sent this survey to folks like myself who were working in the field at the time. They said, what are the key tenets of recovery? They also sent a survey to clients, to folks out, patients also, asking the same question. What do you consider to be the 4 key components to recovery? Well, both groups of people, different levels, different areas, different life experiences, came up with these 4 key tenets. Okay? And I'm just going to hit upon each of them briefly. The first one, safe housing. If I don't have a pillow to put my head at night, what does it matter what my probation officer is asking, that you want to meet with me, what the judge has to say, right? So that has to be addressed. That's a key core component. Then health. We'll talk about health in a second. There's a lot to that. Community. If I need a sense of purpose, and your responsibility, you have a responsibility to give, it would be to help me get referrals and connect me to my community while I'm in the program and when I leave the program, correct? All right. And then purpose. If I see no reason to get up out of bed in the morning because I have no purpose, why get out of bed in the morning, right? So these key critical tenets are what you all can address probably by anyone else on the team. But think about that, okay? You have treatment providers on your team. You have the judge, you have prosecutors, you have defense attorneys, right? You have case managers, but each of them has a particular role that oftentimes will work around these key components, but not address them fully. You all have a capacity to address them fully. So you have critical players. The first one here, just take a second to digest this sentence that you made. And I'd like to have a little interaction, and just, if someone would help you fill in that blank. So the statement is, it's kind of the old games on TV, the games I grew up with, pass game or password, everything like that. Please finish the sentence. As a mentor in a veterans treatment court, I can impact a mentee the most in their recovery by doing what?
Listening.
Listening, I love it. Engaging.
Sharing my experience.
Sharing life experience.
Consistently showing up.
Consistently, ooh, you're jumping way ahead.
Honesty.
Honesty. Okay? There's no magic word there other than being there is probably the magic word, okay? You've all said it in an indirect sort of way. When I talked about those 4 items you saw in the previous slide before the previous slide, right? Health. The population, and I can say this, I know Dr. McLean can probably say the same without doubt, this is probably the population of individuals, the group of individuals you are working with, from a clinical perspective, are perhaps the most difficult group of individuals you can be working with clinically. And what I mean by that is that the veteran population you are working with, as you all know, and trust me folks, I realize I am preaching to the choir, and a lot of information, yeah, I know Scott. Well, I'm just giving you that, yeah, and hold on to that, don't forget it piece, okay? The population you're working with, can they have circulatory disorders? Can they have high blood pressure? Can they have pituitary gland issues, which is endocrine? Can they have digestive disorders going on? Answer? Yes. Can they have everything that's on this slide going on right now? Don't ever lose sight of that. And I recognize that folks in this room perhaps may have everything going on in that slide, or at least a couple of those items that are on that slide.
Mine is the one
Mine's
Mine's the one on the right.
Right.
mine's the one. And the reason, yeah, mine's covered. The reason why I really hop on this point is because medical is so critical. And folks oftentimes will forget that when we're working in veteran treatment models, we're focusing on, is he or she using drugs? Are they obeying the law? But we're not focusing on all the medical stuff going on. And this, to me, is a very easy avenue in for all of you working in the programs to develop your rapport with. Stop here, okay? Don't say to Scott, hey Scott, did you drink today? Say to Scott when you first see him, or you see him in subsequent meetings, hey Scott, how you feeling today about that stomach when you get going on you were talking about yesterday, right? Those are easy conversations. I will tell you, as a former case manager or a therapist, my first question to a client was not, how's your stomach, how your teeth look like you said you want to get them fixed. That was not my world. My world was focused on the substance piece or the mental health piece, right? So let's normalize it. Let's bring it back a notch. Let's talk about stuff that we kind of oftentimes are okay talking about, medical issues. On top of the medical issues, difficult population. Might be waiting by the way. Okay, I'm gonna move up. Thank you. Thank you very much. You're okay if I use the microphone too, then. So,
You're loud enough, you don't need it.
Am I right?
Military voice.
I hate those things.
It's
yeah.
a small,
I'll be right back.
it's a small.
This right here, on top of the other stuff, you got this stuff going on, okay? If you're not addressing the needs of your mentee, your program's not, with the physical stuff, or this stuff, your outcomes, you're gonna see them again real quick, okay? They're gonna be in the tank. As a pretrial service officer, if I focused on this stuff while they're in the program, and they got the job, etc., fantastic, you're doing all you need to do, Joe, move on. Okay? Did I care about that person coming back into the system again? And I was getting paid by the state to do my job, okay? I'm not being disrespectful to any job roles here. What I'm trying to say is you have the most influence, and you are the folks that do not have the relationship that like a pretrial service or probation officer would have with the client. You can affect all this. There are some key core components to a VTC. Again, I cannot point to research and say, if you're not doing this stuff, you're not doing it right. But what I can tell you is this is what appears to work throughout the country, okay? That these key things have to, never walk in front of your slide, by the way. I can't tell you how many sergeant majors after over the years have told me, "Sorry, sir, can I talk to you for a minute? Anything you're doing over there, not good." So these are the key things. When we talk about veteran stuff, we always talk about, now I'm going to make you all feel uncomfortable because I'm walking into the audience. When we talk about veteran stuff, we always talk about addressing like, oh, address the mental health stuff, address the substance stuff, and everything will be fixed, everything will be great, and never see this person again. Folks, it's a criminal court docket, and so you have to address the criminogenic stuff. And I'll talk a little bit more about criminogenic stuff later, but an example of criminogenic things that need to be addressed are they hanging around with the wrong person? Okay? Alcohol, are they drinking alcohol or substances are both a clinical and criminogenic thing that needs to be addressed. How about their overall attitude? Okay, their behavior. When they see the judge, they go, man, that guy's out to get me. Okay? Who challenges them on that, by the way? You all can do it. If I was in court and I say, how you doing? Your name, sir? Say, nice to meet you. Say, the judge is out to get me. Right there, you go, why do you say that? Why are you thinking that? That's addressing criminogenic thinking, okay? So we have to address the mental health, the medical, the substance use, the criminogenic thinking, and the behavior, who they hang around. Stuff you all know. Stuff I want to reinforce in this presentation. Foundation specific. We do trainings across the country, not just mentor training. We do foundational trainings for teams. We do tune-up trainings for teams. We do webinars, we do seminars, symposiums, conferences. We do all that stuff. This is what works. This is what we preach. We're preaching it in the mentor training right now. How many of you have a phase structure in your program? 4 phases or 5 phases? How many of you do not have a phase structure in your program? Okay? See? Best practice across the country. It works. So stuff we're talking about, and you'll be breaking out, talking to each other in different groups, etc. Okay? You're going to find you're doing a lot of things the same. So this is what makes things work. Your treatment interventions have to be targeted. They have to be spot on. You can't put me in a treatment if I have depression and you're putting me in an anger management group, right? So these things we preach again in our sessions we talk about. There has to be participant accountability, and there has to be a plan for when they leave your program. When a person graduates a program, the term we would always hear across the country is they graduated the program. I'll tell you, the term we tend to hear across the country now is they commenced from the program. What does it matter? They're living another life now beyond your program. That's critical. That's good. When we talk about the mentoring component itself, we have to recognize that it is not a formal structure and that it is there because the judge has said the court has allowed the program to be there. Okay? We have to recognize it's separate. And I always want to point out the bottom bullet here. Settle on that bottom bullet. You never want your component to be in a position where you are being viewed by the mentee participant of having more influence than the actual program, than the court, than the judge. Okay? This is critical. This was a few years ago probably the #1 thing that we were receiving. Can you please come and discuss with our mentors this particular issue, where there was a perception that the component, and folks, let's face it, kind of a left-handed compliment to some degree. It shows leaders, right? We have influence, but used wrong, used it appropriately, it can taint the program. Okay? So, and let me give you an example. I've cited this example before, and I apologize to some of you who heard this before. But when I was in my small, humble state, right, the judge's chambers were over there. in every session, the staff got together, had a staff meeting, right? A staff, do you all have that staff meeting, right? And they kind of do a rundown of participants, okay? And I was in that back room because I was the program coordinator. And I was saying, yep, Larry's doing fine, Judge, and this is great, and his wife just had a baby, right? And that information was back there, okay? And that worked out fantastic. Now, the participants were sitting in the courtroom, where I am right now. And everybody would walk through that door, settle within their positions, and then court would begin, right? Court would commence. Fantastic. Your participants saw the team meeting, etc., right? Now, that's how we did it in my state. I went to another state, okay? And when I went to that other state, exact same thing, except they had 5 mentors. And when the team met, everybody came out those 2 doors into the chambers. The judges were, not chambers, outside the chambers, into the courthouse, right? Everybody came out here. 5 of the mentors also came through that door also. Now folks, I can't point to the research article that says that's wrong or that's right. But I can point to human behavior. And human behavior might say, man, I like talking with Randy all about what's going on, but Randy just came from the back room. Did Randy just share some information about me with the judge, etc. in the back room? You see the participant's perspective? It's critical. It's going to destroy, I would argue it's going to really kind of harm the relationship. You notice I was going for destroy. But it's going to harm the relationship. So those are things that we have to always be on tune to. We always have to be aware of. Perception is critical. This slide gets updated just about, I swear, every 4 months. And I went to the great state of California recently, Los Angeles County, and boy, did they chew me a new one, as they say. And the reason why they did, and rightfully so, and I did my homework ahead of time, but still did not put it on the slide. How's that for an excuse? Bad excuse. Any excuse is still an excuse. Yep. We are seeing more individuals from veteran service officers. We are seeing veteran service officers in VTC playing critical roles of getting those folks their upgrades, their benefits, etc. So these are all the players. By the way, this whole slide deck's available to you. You don't have to take pictures of it. You can get it afterwards. When we talk about participant success, just a little graphic visual here, we have to recognize that it's just not one of us, it's many of us. It's many items. If you had to look at this and you were a therapist, you say the most critical one is the clinical need. If you're a probation officer, you may say it's criminogenic. Defense counsel, prosecutors, judge says make sure I get the legal stuff taken care of. Mentors, you fall into that other piece. And I'd argue that that's probably the most critical piece, the social connectedness piece. So the veterans, the mentors that we see now in our communities, in our programs, come from all over the place. Some states do have mentors. I'll just ask openly, maybe mentors. No, I won't ask openly, but there are some states that have mentors that are paid positions. Okay? Majority across, I'm not saying that's bad or good, majority of mentors across the country are volunteers. And the majority of mentors across the country typically will serve 1 to 2 years in a VTC. Okay? Some longer, nothing wrong with that. For continuities, for treatment inspector, the more you have a person secure, you know, that's really great. But usually about 1 to 2 years. So gosh. My kids in my slide now. Bottom bullet, whose expectations? VTC mentors have realistic goals and expectations. Whose expectations? The mentee's expectations, right? We'll talk about that in more. We have always taught these 3 critical E's about the role of the mentor. Number 1, engagement is critical. Now, engagement kind of says, engage with mentee, be available, be dependable, listen more, speak less. I'll never forget a real quick story where I had worked in our VTC in Rhode Island, and I was a case manager at the time, and I was doing everything for this participant and really focused on, I was like over-identifying perhaps with this individual, but I was really focused on that person, okay? They had a mentor. The mentor would say to the other mentor coordinator, I spoke to the mentor coordinator, you know, my guy never talks to me, never says hi, just kind of barely acknowledges being caught, okay? And I said, oh, you know, whatever, you know, yeah, I was a case manager, I was doing my job, you know. He was doing everything and then some for me. And as far as I was concerned, we had an awesome, fantastic relationship. Okay? Graduation day comes. Judge says to the participant, anybody here in this courtroom that you'd like to thank for helping you through this program? So of course I'm doing the old. I'll try not to embarrass. Yes, I would like to thank Jonathan, Your Honor. Jonathan's the mentor. Jonathan's the mentor who spoke to maybe 5 sentences throughout 5 phases of the program. Okay? Why did he do that? Why do you think? Why did he think so?
Human nature.
Human nature. Can you go on that a little bit more, sir?
Right? We like ourselves. We have a way of, showing ourselves in a certain way, and we like to dress up in front of the mirror, right? We want to look good.
Okay. Very well, sir. Someone else, sir?
Was he a volunteer mentor?
He was a volunteer mentor.
Well, he was doing it because he wanted to be there and you were getting paid to be there, I'm assuming, right?
That's absolutely.
Yeah.
Okay. Well, speculated, right?
Not speculating.
I'm with you. Somebody else?
One's a forced relationship and the other one is a volunteer-based relationship.
Piggybacking off this gentleman, absolutely.
Unspoken kinship,
Talk about that, sir?
relatable experience.
Just couldn't identify with me.
Yeah.
Anyone else? Okay, thank you for the therapy session, I appreciate it. No, shoot, the point of my story, it actually really is to find a lie you did not like. The point of my story is to find think about this mentor. This mentor showed up in every court appearance. I didn't tell you this. This mentor always smiled and greeted him, even if he did not get a greeting in return. This mentor called him at least twice a week, even if he didn't pick up the phone. Okay? And this mentor absolutely volunteer and not a paid position, state employee. Okay? So I also want to point out with that story that you can never, ever underestimate the impact you may have on someone else's life or someone else in general. Never underestimate that. That mentor actually said to the mentor coordinator, I don't get it. But he said that, the mentor didn't get it either. He thought everything was in vain, but no. And that, as of like 2 years ago, I know they were still communicating with each other after leaving the program 7 years ago. Okay? So this is a long story. Please.
I had in my mind also, you said he didn't say a lot of words. It could have also been that he didn't say a lot of words because he let the other guy talk.
Absolutely. And Matt Oren today is going to come at the end of the day. He's going to do a session on critical listening skills. So, thank you.
Silence is powerful.
I have a slide that says that. I'm not kidding. I have a slide that says silence.
What's your thoughts on having mentors be prior clients in the program? And secondly, we've been focusing a lot on trying to match or bring in mentors with different either backgrounds, branches of service, try to bring and maybe specialties in order to, one, we have guys running group management issues, we have guys that are in the Army, there's guys that are special forces, all that, we're trying to get the right mentor for the right person to identify with the client so they feel comfortable.
Everybody heard that question, matching, etc. Randy is going to take that question on full front force to her session, either today or tomorrow, I forget. Because subject matter expert in the room around that type of thing, Randy McLean, Dr. McLean. And I'll answer the first, because it's an easy question for me. As far as former participants now being mentors, what we see across the country, again, do not point to the research article. What we see across the country is we recommend that a participant graduates the program and takes 1 year off. And that's from a clinical perspective. It's all kind of rooted in that common sense, common orientation. I need a break, I need to recollect, to regroup, so to speak. So 1 year from the time they graduate to when they become a person in the co-op program. You may do it differently, some folks, but I just want to say that's what we tend to see across the country. This gentleman first, please.
I'm a former, my name is Fritz. I'm a former graduate of the program. And I didn't know about the mentor thing, but I kept coming to court to help the other vets out. And then down the road, about a year or so, my boss, like that, he officially put me on board as a mentor. I developed relationships with the other vets, and I think a lot of our success rate goes up because what we have in common, I went through the program, I had to do what I had to do to get it right, and I'm available for them, and they call me whenever they need me, things of that nature. But there's a lot of the small stuff that helps them get on board. When they see another person that's been through what they've been through, they're more susceptible, thinking they have an opportunity to change too.
Thanks, sir.
That's it.
Really graduated. Okay, there we go. A lot of graduates. Cool. Fantastic. And just not to get too, I have to stop myself sometimes. But honestly, one of the reasons why veteran treatment courts are so successful for recidivism rates is that the mentoring component, but now we see the peer component also. So these are specific things we call responsivity. And with veteran treatment courts, we're able to drill down on the responsivity, which means we're able to know what the particular issues could be that Scott has, and so now we can address them full on. Versus traditional prosecution, where we don't know what issues Scott may have or may not have, if he served, if he didn't serve, etc. Does he have a peer who we can connect with, okay? We are also seeing, by the way, so that's called responsivity. That's a great term to remember, by the way. Making veteran treatment course successful, responsivity, big VA table, and the mentoring component. Those are the big three. That was your test to graduate, but I just give you the answer. So the other piece around, so we engage, moving on, we encourage, we as mentors need to be the cheerleaders, so to speak. Okay? Not just with the participant, but also with the court judge. I can't tell how many judges have spoken to me because I'm a trainer and they're probably never going to see me again, but they've been very candid oftentimes. They said to me, I don't know if what I'm doing, Scott, really makes sense, or if I'm doing it properly. Now they say that because they may not have been a veteran themselves, or they may not understand the culture too much, but you all are the folks who can encourage them in an informal way that they are doing it properly. Well, here is a suggestion. A room full of NCOs, especially, how well versed are you at taking along a young second lieutenant and saying, sir, actually your platoon's over there, okay? And not insulting me, right? So you are making a difference. You are doing great stuff. And then empower, sir.
I'll go back to the other slide.
Yes,
so under encourage the court, understanding the veteran. So my question is it a hindrance or a benefit for you to know the full background of the mentee, i.e. charges, all this stuff? Or is it you just meet them one-on-one, meet them where they're at?
That's an excellent question. Randy's going to cover it in boundaries.
These are all my things.
So this is why I'm so glad we're doing mentors and mentor coordinators together. So can I point you to the article that says this is exactly what the research says, and when I give you my answer, it's law? No, I cannot. Okay? But I can tell you from what we've seen, it's there's two approaches. okay? Is one approach that we've seen where the mentor does want to know everything about the criminal offense, what was involved, you know, almost at a prosecutor level or defense counsel level. And there's another flow out there, or general thinking that I don't want to know nothing other than, hey, what's your name, sir?
Olaire. Olaire.
Olaire. Hey, Olaire. Olaire's in front of me right now. I'm talking to Olaire. I mean, the fact that Olaire's in court tells me he's got some criminal charges, okay?
Yeah.
But I worked in the jail and prison for 11 years. I can tell you I have bias to particular offenses, okay? I can play the game and say I don't, but I do, okay? And if I know that there's a particular offense that really I am very much is one of those things that I am biased to, I'm going to have a different relationship with them. Right? So that's my approach. I'm not saying it's the right approach or wrong approach. I cannot say that. We recommended justice for vets, however, that you have minimal understanding of those charges so as not to cloud your judgment, to be non-judgmental. Because if you want to be non-judgmental, you can't have that other stuff in the back that they're judging from. I know that did not make sense, but you know what I'm talking about. So, and there's also in the clinical world a whole school of philosophy of working with the person in the present. Who you are today is all I care about. I don't care about your past, I don't care about your criminal charge. I care about, let's get you through this program, let's get you social connectedness, let's never see you in this program ever again, let's you and I have a rapport later on, let's get you connected with some service organizations. Sound good? I'll leave it at that. We're just doing that. Marinated, as they say. Empowering, especially important, this is the classic. Are you going to fish for the person? I give up the analogy. Or teach them to fish. And the answer is you're going to teach them to fish. Every time you speak for Scott, you are speaking for Scott. You are enabling not good. You want to empower Scott to speak for himself. You can, this is later on in life, but these are the key actual foundational trainings we recommend for mentors to do at least twice a year, or at least once a year, right? I know some programs that do this, that address this stuff quarterly. The mentor coordinator calls it a summit. There's a ton of topics that if you are a mentor coordinator, you would want to make sure that your foundation, those principles being passed on to your mentor component. And if you're a mentor component, you're a mentee, you should be asking for them. Hey, I don't know anything about this alcohol thing. I need to learn more about it. Traumatic brain injury. Please, can we get somebody to talk to us about that? Because I think my guy that I'm working with, or my gal, and then the mentor coordinator stuff that we see, I refer to this position as herding cats. So the mentor coordinators around, sometimes it can be very challenging because you're working with, volunteer mentors, you're working with the court team, you're working with individuals on the court team, you're working with outside organizations, so it's a very challenging role to be a mentor coordinator. We have mentor manuals available. You can write to me, you can check out our website. There are templates from throughout the country. If you do not have a mentor handbook, please feel free to reach out to me, check online if you cannot find one, but no sense in reinventing the wheel. We have the Bureau of Justice Assistance has recognized 5 veteran treatment court programs throughout the country that can be models for other VTCs. I can put you in contact with them or your team or your judge, whoever, if you want to. Here's an example. Anybody from Nebraska in the room? Nebraska is one of the recognized VTC mentor court programs. That means they have a spot-on manual, participant handbook, mentor manual, SOP, okay? You can go, the staffing is handled. Do they do things that might be a little? Yes, because these programs are all shooting for always further development, right? Further production. So it's very important that in your mentor handbook, you have a plan for maintaining, innovating, and recruiting mentoring component. And just a few more slides here. I recognize the time. We want to get a cup of coffee or something. But these are critical things that if you're a mentor coordinator, you should be doing for your mentoring component. Or if you're a mentor, you should be looking to receive some guidance on. The first one is maintaining the actual component itself. it's important that if you're a mentor coordinator, your mentors are vetted. Raise your hand if you're mentors, volunteer mentors, if you're a mentor coordinator, go through a screening process with the local DA. Fantastic. That seems to be more the norm than anything, okay, across the country. About 5 years ago, I'll tell you that. Now it is the norm. So there has to be a vetting process. There has to be a training, yes.
We added a secondary one where all the mentors that are currently in the program have to vote on the new mentor coming in to see what kind of person he is, if he's known, what he's doing in the community.
Okay, did you get that? Yeah, actually, a voting, so it's kind of like, almost like a panel, like, hey, Scott, you want to be a mentor? Well, let's take a look at it. Okay? So, again, where are you from, sir?
Lackawanna County, Pennsylvania.
Pennsylvania, Lackawanna, I love that, Lackawanna County, Pennsylvania. Okay, so that's something they do. It might be something you may want to consider. It may be a good idea, it may be a great idea, it may not be, you know, but that is something that's working in Lackawanna County. Thank you for sharing. So this vetting process, that would be part of your process of vetting would be that additional step, or that normal step. Without this type of training, I know folks, a lot of you may be sitting in this room right now going, yeah, you're not telling me anything new, but I hope I am just a little bit, because it's so critical that you're always looking to develop, right? You're always looking to enhance your skills so that the person you're working with can have better outcomes, right? Innovating, you know, we used to call it, I used to always refer to it as the mentor component. We would like the term mentoring component, meaning it's in action, it's always moving forward, it's not stagnant, it's not stale. When we say mentor components, yeah, it's just another thing that the court has. It's another structure of the court. You are not another structure of the court, okay? So we want to stand out with that. And then we do want to have a little discussion on this. What do we do for recruiting new mentors into our program? So it could be a coordinator answer or a mentor. Somebody give me some ideas. What do you do? I mean, I used to go to the local Elks all the time and look for bodies. Say, I don't want your money, I want a body. Sure, what do you say?
I used to say that go to DAV, put the word out in the community, go to some of the meetings, the meetings of different facilities there in the community, and just word of mouth, pretty much, word of mouth. We upload images as well. Sketches coming in, and kind of tell everybody what we do. Our program is a little a year old, so still getting the word out there, but it's been, actually I have more mentors than I have participants right now, so.
That's good. More mentors than participants.
Right, so that's what we're doing.
This gentleman.
Yeah, so we, I work with Rick County Maryland, and we partner with a nonprofit, called 1822. And essentially, they gauge all of the people that come through their doors and everybody that they service, and they ask them if they're interested. They identify a need for a sense of purpose, and then
We say an old term, rewind. So this is innovative to me. So you actually work with a nonprofit, a community nonprofit, and they're assisting you in doing the outreach. You ever hear that? Probably, because you're LA County. Yes, I have not. I have not heard that of community behavioral health or community organization. Fantastic. This gentleman.
So, I look at veteran stand-downs, go there.
Veteran
When they're
stand-downs.
doing job fairs for veterans, even community stand-downs for just the homeless and stuff like that, to be there in that area as vets, because most of them are vets in the area that are homeless. And sitting there at our table and stuff like that, trying to recruit them from that point of view and gauge their interest.
So you are in the field looking for them. Sir?
Okay, so we're with the University of Chicago. So one place that we present to is sometimes our student veterans. So we'll get some veterans that will come out of the university that want to volunteer, particularly those who are in social work or law, those ambitions. But we also have presented co-collaboration with the Chicago Bar Association in conjunction with veteran services organizations. Kind of a twofold call to action. One, we're seeking lawyers who are willing to do some pro bono work to assist our veteran participants with civil matters, but also to encourage them to volunteer as mentors. And many of these folks have never even heard about a veterans treatment course. So those VSOs is kind of like illuminating to their consciousness of what's going on, and kind of that sort of spurs the idea that, hey, would you like to come present at our vet center of sorts? So those are two factors.
Fantastic. VS, the local university, Veterans of America, Student Veterans of America. SVA. What else we got in the back? Okay, Leanne?
Oh, I'm in the same boat as this gentleman, I have more mentors than I have participants.
Wonderful.
But the majority of mine come through our local VA. They put together with me a little video that they put on all their TVs throughout their facility as a VA, as the veterans are getting hospital care or medical care, whatever's not there, they're taking out of the VA. They watch it and then contact me.
Wonderful. Very good. Gentlemen.
Just jumping in, we do some of the things you've already seen. We're in Delaware County, Ohio, which is north of Columbus and Central. We participate with the Inter-Service Family Assistance Council to spread the word so that if these folks have service members that find themselves engaged in the community and aware of our program. We also post flyers in the National Guard armories. So we're getting twofold there. One is folks that are still in it or just getting ready to retire, they're aware of the program and reach out. The other is there's a natural thing that's already occurred. They're serving guard folk. We know they're still possess their clearance. They're generally free of offenses, unless they're not.
And we're finding these grassroots groups that are organized, they're younger generation guys that are doing their own thing. And if you can tap into them, you get a motivated group of people that want to be their peers. It's quite interesting.
It's wonderful. Yeah. That's another, kind of innovative things I haven't heard before.
So, I think that last point is really important too, because we start looking at demographics of veterans and availability. You look at your traditional accredited veteran service organizations, and you have a median age that's constant stream of folks leaving the military. Trying to find recruiting and mentors, as a fellow student, getting other student veterans involved. Of course, during the day, I have a job. The mentor pool that you're going to draw from, and statistically, is retirees, people that have the availability in the day, and then outreach and meeting the needs of the evolving, the GWAT veteran who's looking for information on Instagram, board on a region or a post that they never go to. It's just different, and trying to match those two is something difficult when you got to look at the demographic picture.
So we could go around the room again and again, I know, on this topic. And this is, the other purpose of this training, this type of training, is make sure you don't talk to each other. There's like, how many different states in this room? All different regions, with a lot of commonalities, but also a lot of nuances. And so, please take the time during the breaks to, meet each other, greet each other, talk about these things. Really, that'd be a great objective today. And with that, I'm gonna thank you. So please come back for the next session. Oh, sir.
Just want to make one comment earlier. When you talk about that mentor that was staying,